Spectrum disorders and executive function. Just think of the child and what executive function for these children with autism spectrum disorder looks like. Children with spectrum disorders often have weakness with executive function. Transition to school relies on mastery of basic executive function skills. For example, getting ready to go home from school. For the other children, this task is routine, but for a child with autism, they struggle with regular routines such as this. There are 4 executive functions important to complete daily routines and play successfully at school and at home. They are shifting cognitive set, inhibition, working memory, and planning.
Shifting cognitive set is the ability to transition from one activity to another. Children with spectrum disorders appear rigid because they want to complete tasks and like routines and play the same way each and every time. These children resist transitions, thus they don't respond well to demands with adults or peers. Inhibition, impulse control, is the act to wait later before doing an activity or receiving an award. Children with autism have difficulty with impulse control. They often can't follow the rules because the desire to do what they prefer is so great. These children often cannot complete an activity without being distracted.
Working memory is remembering all the steps to reach a goal. For example, getting ready to go home from school. A child needs to remember all the steps that make up the routine. Weak working memory contributes to these children not being able to complete a task independently, even if it is an overlearned activity. The picture schedule is so helpful to a child like this because it helps the child see the steps she needs to do for the routine. Verbal working memory is often an area of weakness for these children because of language impairment. The visual information provided for them helps with their verbal working memory weakness in home, at school, and at play. There is a greater chance for the child to complete the task successfully using a picture schedule.
Planning, sequencing steps to reach a goal. This is difficult for the autistic child. They prefer to carry out plans or tasks the same way every time. They have difficulty with this because of their poor planning skills along with weak set shifting and work memory skills. Planning skills require all of these skills: having a goal, understanding the steps to reach the goal, ordering the steps logically, staying on task to reach the goal. Many children with autism have difficulty with this type of situation because of their poor planning skills along with weak set shifting and working memory skills. Motivation is the key to help children.
This presentation shows only one of the ways that executive function can be affected. Not all children with spectrum disorder have impaired executive function, but up to 80% of them do. Strategies for these children are patience, praise, time, and motivation. Help them become successful.